Good morning, everyone. Welcome back to my frequently asked questions of the week. Those of you guys who don't follow me, I do this pretty much on every Wednesday, and I think my patients enjoy it. I think my patients feel, I get feedback and they learn something. I'm gonna give you my answer on how I answer these questions. These are from my patients that send me messages through social media, and/or Linda gets them as well. So I try to have a whole list, and I really want to make every effort to make sure patients learn as much as they can about plastic surgery and the procedures they're interested in doing, and hopefully they get to know what they should expect when they actually meet me and talk to me about it. So the question of the day today is about tummy tucks, and the question is a very common question: is how much skin is removed with a tummy tuck? Well, the answer is depends. It just depends. Depends on the amount of laxity or extra skin of your abdomen that you have. There's a spectrum of tummy tucks, right, that we've talked about. I've done a question on that before. There's like a mini tummy tuck to a regular to an extended, all the way up to a body lift. It depends on how much skin you have. It's all about how much extra skin you have. Some women just have a little bit of skin, like on the lower part of the abdomen, right next to like the mons area. That's called we can take that off. That's called a mini tummy tuck. You have a little bit of loose skin between your belly button down. The skin on your upper abdomen is great. Sometimes you need like a modified version of a tummy tuck. It's just all about depending on the skin laxity. But for me, the tummy tuck long incision is really important for me to keep it as low as possible. And I would say most surgeons agree with that. The incision placement where that incision going to be can be pretty much permanent. You can't fix it, and we'll talk about that in a second. But I try to keep mine very low. The goal is to wear, normal underwear and bikinis, and you're not be able to see the incision line, the long incision line. So sometimes there's enough skin to get the skin from the belly button down to that lower incision. Sometimes there's not. Sometimes you can't get all that skin out. And so if you were to cut it out and you don't want, what would happen is you end up closing all that skin, you actually have a high scar. So your incision like literally right on your belly button. And it's because you didn't have enough skin to take out. I've seen surgeons do that, and surgeons do that. That is not fixable. I cannot lower a tummy tuck scar. Can't do it. That's done. You're done. Like I can't fix that because there's no more skin between that lower incision down to like the vaginal area. That skin will not stretch anymore. It's been fully stretched to meet that incision at the top. I can't lower it. You just can't. So I hate seeing that when I see patients for second opinion to get my tummy tuck scar lower. You can't do it. The way I avoid that, and if you don't have enough skin to do a full tummy tuck, either there's some kind of modified tummy tuck. And what that means is sometimes what we do is do a little vertical incision where the belly button was, and then that becomes part of the tummy tuck. It's either right at the bottom of the lower incision or just above it. So that scar actually heals really well. It's really the long incision. The long incision is one that you want to keep low. You want to keep it low. So that's it's about the aesthetics, and I would say most surgeons would agree with that. Some just they'll do a tummy tuck pretty much in anyone. And I've seen this quite often, is that these tummy tuck scars are just, they really need a tummy tuck or barely needed it. Needed a tummy tuck, and then you have the belly button, and then literally like an inch below it, you have this long incision. I can't fix that. So that's kind of the important concept of how much skin is removed. It just depends on you. Everyone's built a little bit different. Everybody has different body habits. Everyone has a little bit more fatty tissue than others. It just kind of depends on you. So what I encourage you to do is go see a surgeon, and maybe see one or two or three. Don't see more than three, and get their opinion. Right? Where would my incision be? How long will my incision be? How do you close my incision? Those are kind of questions you want to have answered for you. So, great question. Hope you learned something. And again, I'll see everyone next week. Thanks.